J. Dossen Memorial Hospital, located in Harper, Liberia, was constructed in the year 1949 by engineers from Germany during the presidency of William V. S. Tubman, himself a son of Harper. In response to the critical need for a hospital in the southeast, Tubman's administration constructed a well-equipped hospital. Officially opened for the use of the public in 1960, the J. Dossen Hospital went on to be a leader in healthcare provision to the people of southeastern Liberia and western Ivory Coast. But from 1989 to 2003, Liberia suffered from a bitter civil war fought by at least 10 different factions on various fronts. 14 years of unrest left behind a ravaged infrastructure and a healthcare system incapable of responding to the needs of the Liberian population. In their rampages across the country, the assorted rebel factions left few buildings untouched. J. Dossen Hospital was not spared.
Everything in the hospital was looted, down to the mattresses, the beds, even the operation tools that they use, the surgeons use. Everything was looted from this hospital, bringing everything to a standstill.
Aside from the looting, most of the buildings of the hospital were physically damaged, unroofed and exposed to the elements, and in many cases burned. As a result, 14 years of neglect left behind a crumbling and rusted infrastructure and few usable hospital materials.
The delivery table that we have here is not in good condition. It's very old, it's rusty, the foot is not, the feet not, they are all broken, they are not good. So if you put patient on it, I mean, we just try our best because we compare to do it, but everything laying like this is spoiled. It's not in good condition. And we don't have enough instrument, the delivery set. We don't have it. We have to have enough here to sterilize it and be using it as we use it, we put it away. But we don't have sufficient here.
In addition to the physical destruction of the hospital, the war's toll on the hospital staff was equally dramatic. Most of the qualified health personnel fled the county and settled in less remote areas where jobs were available and the living conditions easier. As the war dragged on, the institutions of Liberia's government, such as the Ministry of Health, stopped functioning. Healthcare professionals were not being paid. Fewer and fewer of the trained medical staff stayed in Harper to continue working at the J. Dossen Hospital.
We don't have professionals. We don't have a Liberian doctor here. Most of our registered nurses and PAs are out because of the war, and then since we return, most of them are still out and they are not here. We have only nurse aides and other administrative staff working. The professionals are very few with respect to physician assistants, registered nurses, LPM, midwives, etc.
Approximately 250,000 people in southeastern Liberia and western Ivory Coast are served by J. Dossen Hospital, most of whom slog their way through a ruined and dilapidated countryside to reach Harper. As a result of 14 years of chaotic war and the scarce access to healthcare, it is not surprising that Liberia now holds one of the world's worst healthcare records. Maternal mortality rates are amongst the highest in the world, and the average life expectancy is 40 years for men and 43 for women. Many children die each year from preventable illness. In June 2004, Merlin began operations in southeastern Liberia through an emergency response to a cholera outbreak in Harper. Merlin had already been operating in Liberia since 1997, working to support primary and secondary level care. When Merlin first arrived in Harper, the situation at the hospital was critical. Providing patient care was extremely difficult during the outbreak, and emergency surgical interventions were impossible. What Merlin did find, however, was a solid physical foundation that with a longer-term intervention could be rebuilt and rehabilitated.
There's a lot of work we've got to do here on the buildings, which we've got plans for already, and it's a really nicely laid out hospital. Very spacious, relatively modern, and I'm pleased to see that most of the physical structure is in good shape, and I think with a bit of luck the work here is going to go quite well.
Merlin proposed to expand its activities in the hospital to rehabilitate the operating theatre, the paediatric ward, maternity ward outpatient department and laboratory. To make a sustainable impact, Merlin would not only rehabilitate the buildings, but also take on the difficult task of providing training to the staff. The British government, through the Department for International Development, responded to the needs identified by Merlin.
The whole idea with this project is to make it a functional, sustainable system. So Merlin is not here just to provide the money to put in the new pipes, put in water pumps, supply nice, shiny new hospital beds. That is only part of it. The other part, which is probably more important, is to help and advise people as to what they need to be doing to keep the place running nicely, so that when we're gone, they can continue.
Summer 2005, the work goes on. Despite the logistical difficulties of working in a community barely reachable by road, Merlin managed, piece by piece, to procure the materials needed to begin the rehabilitation of the hospital.
At this time, it looked much better because Merlin came in and they started doing renovation. They put zinc, and they are trying their best to give some medical attention to the patient.
Working with the local population to rebuild, a work plan was drawn up to reconstruct the different hospital wards. Everything needed to be replaced. The walls were repaired and painted. The ceilings and floors had to be extracted and retiled. Windows needed to be refitted and new glass added. Shelves and furniture were built from scratch. Water and electrical systems were restored. Bed sheets, gowns, curtains, mosquito nets, uniforms, all were sewed on site to stock the hospital.
Some of the physical things that are going on here, one, the roof, the ceiling of most of the walls have been changed. Most of the doors that were rotten have been replaced. And then painting work is going on. Even the floor in the operation theater and the obstetric ward, the floor has been removed and tile is placed on the ground. Some of the pipes that were so rusted have been changed, and the water tower has been cleaned and installed. And these are some of the things that, physical things that Merlin is doing. And they are supplying all the logistics that we need in order to run the hospital. The cleaning materials, anything, the medical materials, the drugs, and all have been supplied by them.
With word spreading throughout Harper and much of the region of the improved conditions at J.J. Dossen Hospital, the training of the hospital staff took on an immediate significance. Merlin brought in an expatriate doctor and hospital matron to accelerate the amount of guidance and instruction the local staff were receiving. Hospital management systems were put in place, and incentives were paid to keep and attract new skilled workers to the remote corner of the country.
Harper is in an area where there are hardly any facilities. It's in fact the only hospital that serves the whole of the southeast. They're a really forgotten part of the country, and there's something to work on. There are people there who want to improve that hospital, who would like our help in rebuilding it. And we know how to work with local people to help them do most of these things for themselves.
We want to tell this gathering that Merlin did extremely well. And even they went above some of the units that were not in their contract. They decided to do it because they felt that there was a need. After renovating, rehabilitating this institution, today we are here for the reopening ceremony. Today, the J.J. Dossen Hospital that was opened officially in 1960 is going to be reopened to the public, and we urge that the public should come. All treatment is free. You don't have to pay 1 cent.
Father, the Son, and the Holy Spirit.
8 months after the start of the renovation of J.J. Dossen Hospital, Merlin handed the hospital back to the people of Harper and southeastern Liberia. Thanks to the generosity of the United Kingdom's Department for International Development, Merlin has rehabilitated, re-equipped and staffed the hospital and put management systems back in place. Merlin has also been able to provide essential drugs and medical equipment, training for hospital staff and technical support through monitoring and supervision. Key wards at the hospital have been rehabilitated, including the operating theatre, the laboratory and the maternity and paediatric wards.
I feel very fine because actually when Merlin came, we underestimated the work they could do. But within the shortest possible time, they have done a lot. So I'm really impressed of what they have done, and I'm convinced that the money the donors gave Merlin to use, they have actually used it.
J.J. Dossen Hospital continues to give free services to all patients. By providing essential services such as consultations, vaccinations, antenatal and postnatal care, emergency and surgical interventions, the number of patients seeking healthcare has increased by over 100%. Already, the local population knows about the improved quality of the health services now available at the hospital.
The community in Harper, the people are very happy. Even if you go downtown, you hear they are praising Merlin. And Merlin is doing well. They are happy that they have a facility here that you can come anytime. Over here, you can come in anytime, any part of the day, every day, whether the holiday, whether the Christmas. This place is open to any patient. They are free to walk here. And the hospital is free. They're not paying anything. They come here and get all the good facility. So they are all happy.
The war is finally over in Liberia. The people have elected a new president, the first woman president in the history of Africa. Now with the new government in place, its institutions will be free to grow and eventually stand alone. As this happens, the Ministry of Health will begin to assume more responsibilities for the operation of the hospital, but this process will take time. In order to continue building on the substantial progress made thus far, further support to the hospital will be required until the county health team is able to take over full management of the facility. The road ahead will certainly not be easy. At the end of the war, there were only 21 professional Liberian doctors in the entire country.
Merlin sees the job through. It will try and support people to build up their own health systems, their own clinics, their own services. And until we've helped them get things running and we're not needed anymore, we will aim to stay.
J.J. Dossen has now started to play an important role in the lives of the people of southeastern Liberia. The hospital, like the communities it serves, illustrates that Liberia is turning a corner towards a brighter, healthier future.
Togetherness, we can do something. But if we are not together, we can't do anything to carry on any development within the county and within the community. So I think we need to come together as Liberians and put the one thing behind us so that we'll be able to live in peace in our county and in our country, in our community.